needs and provide and fulfill those needs. If you're a vegetarian, if you're averse to somebody eating meat, and you can't feed a West Asian, we can't feed somebody whose predominant diet is non-vegetarian and tell them in this hospital we don't serve this, and then you have kind of difficulty, then you need to extricate yourself from the relationship and ask for a change. But you cannot impose your beliefs, you cannot impose your methods, rather than understanding the cultural necessities of a patient, which is extremely important. So do not be judgmental. You have to be very open-minded, absolutely flexible. Then only it can lead to appreciation by the patient and assertive communication. Now, assertive versus non-assertive behaviors. Let's look at this slide. The characteristic is that if you're going to involve in decision-making process, an assertive nurse tries to make her own decisions or his own decisions. A non-assertive person always lets others choose for them. An aggressive behavior is choose for others. So let us forget of the aggressive for a moment. None of the nurses in India are aggressive as far as I know. There are very few, I think. This only applies to the Western. So we'll forget the last column completely. So let's focus on assertive and non-assertive behaviors. Now stance. Now what does stance mean? The way in which you posture and stand. When you're walking into the patient's room, you just go and stand like this and looking at the patient, That's not something that they will appreciate. So your composure, your standing, a smile on the face, that in itself is worth $1 million. So your stance is very important. You're looking relaxed. You're looking relaxed and not kind of bending over, stooping over, looking there, looking here, or picking up something is not attitude. I practice this. Sometimes I used to see 35, 40 patients in a span of 2.5 hours. As doctors become busier in their lives, as the pressures mount, everybody wants to be seen. I practice this art. I used to rush into the patient's room, but never see the patient I'm rushing in. I'm rushing in the hallway. When I'm coming out of the patient's room, I walk very quietly, taking those baby steps. The moment I'm out of the door, I'm running again. Okay? It's absolutely an art. That is what is called where the patient appreciates. She's walking in, he's walking in. He's so relaxed. He's coming to take care of me. He means, or she means, I'm important to this nurse. She wants to spend some time with me. Which is extraordinarily important, ladies and gentlemen. So when you're visiting, have an eye contact. Give that feeling you're there for them. You're there for that patient. You came in particularly for that patient, no matter what is the next patient has done to you. You might be taking 3 or 4 patients. The next patient has completely upset you. Okay, that is that patient. But you're walking into this patient, you're forgotten in that split second, and your demeanor is quiet, a good stance, a relaxed feeling. That is the calling of healthcare professionals. We have chosen this profession because we are the ones we can do this, not everyone. And this is extraordinarily important. Hands, your gestures. Now, hand gestures are important. That always gives an emphasis, like the way in which I am doing right now. When I'm saying emphasis, my hands automatically rise. My brain cognitive function is realizing this. This is something important that I can convey. I'm gesturing. Now, appropriate gesturing is very important. Now, you can't do this patient. No, 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 no. Do not ask me again. I told you so. Okay? Which is completely wrong. It's a wrong gesturing. So be careful when you're gesturing, and don't keep your hands very fidgety and clammy. You're moving this, moving that, putting a wire here, putting a wire there. Nervous people. That calls for unnecessary observation that the nurse is very nervous and you don't know what you're doing. So a cool, relaxed stance, a proper smile, a relaxed demeanor, and a few hand gestures can go a long way in comforting the patient. And your voice should be firm. You should come across confident, and there should be some warmth in that. You just don't talk at the door from a distance. I heard you. I can't hear you. Or say that again. Or yelling at the patient. How many times did I tell you? Did I tell you in the morning the doctor is not going to come today? Didn't I tell you you don't have a CT scan today? That's not the way to address. No matter how mad you are and if the patient even cannot pay, maybe the lowest socioeconomic background, or illiterate, or the patient family members bothered you, but you don't change your personality. You are who you are. Your expression, if you continuously change, then what happens is that confuses your mind. Your approach should be the same thing whether you're seeing a patient who is rich enough for a VIP, or a patient who cannot afford, or a patient's family who cannot understand what you're saying. If you practice this uniformity, you're going to completely eliminate confusion, and you'll always win. This is something I should teach a lot of doctors in the US. You can go to bed peacefully. You'll not have any conflict in your mind, because you know as a person, this is my approach, irrespective of who it is. This is what I'll be dealing, this is what I'll be doing. That makes your life very simplified and very easy. So apply the basic tool of assertiveness of these characteristics that will help you. Your eyes, I already talked about, good eye contact is always helpful. So the 5 steps that go in the nursing process, which are well known, is that your assessment of the patient, nursing diagnosis of the patient, your plan of care of the patient, and then implementation of your plan of care. And certainly at the end of implementation, you're evaluating yourself. How did your implementation of this patient's care turn out to be in terms of a response? So these are all the 5 basic steps. Now, if these steps are validated, now we need to validate them. What does validation mean at the end of the day? Assessment is you take this checklist, you have the computer, iPad, and whatnot. Ask the patient, what did you come for? Okay, I came for headache. How long you have the headache? 3 days. How was your headache? It's partial, it's total. Okay, check. Nothing else is happening. So what you're doing is that you're just going through the illustrative steps that we are supposed to be doing, but there's no life in it. You're not connecting with the patient. You're not exploring further details that will help you to have a more effective plan. Again, communication. Again, confident communication with the patient, where you can extract, while you're asking the same question, enough information that help you to make your plan of care so effective, ultimately the patient benefits in that institution. So just don't be bookish. Just don't be, what we call simply methodical. I'm a big believer in checklists, but checklists have their own place. There is life beyond checklists. Let me just tell you. Checklists can be monotonous, although they're methodical, but they don't impart what is called as that warmth and connectivity. So never forget engaging that patient in spite of your checklist, which is going to make your plan of treatment and the ultimate outcome of the patient extraordinarily well. Now, what does responsible communication mean? Certainly focusing on the nursing processes, which we just talked about. Now, considering the world of the patient and the family, giving that importance, we talked earlier this morning about patient-centric care. Ultimately, what does that mean? Patient-centric means the patient is in the center of everything that is happening. He is the center, he or she is the center of your world for that moment in the time that you're spending. Essentially, that's the definition. There's no other magic definition to patient-centric care. Everything you have to forget about for those moments that you're spending with the patient. He or she is your focal point, is a center at the action of everything that you're planning to do. So you have to consider that. You have to give so much of importance that you're making their world, absolutely comfortable, and their family members too. Many times you go in with a smile, you greet the patient, thanks for choosing this hospital, our doctors are good, we'll make sure that you recover and go home. We'll instruct you everything at the time of your discharge. Roughly, you may take about 2 or 3 days. All of these things in first 3 or 4 minutes. And you've formulated an opinion with the patient's family, and then they're coming out and telling the administration what a fantastic nurse she is. We get these compliments every day at this hospital, where patients say that, what a beautiful nurse, what fantastic nurse we have. She takes a wonderful care. Can we have again in the same shift? you know. So what he or she is doing is nothing more than adopting these basic skills in terms of making the patient very comfortable, and always being a patient advocate. Never contradict your patients. Don't challenge them. Patients can be wrong because of their ignorance. They can be wrong in their beliefs, and particularly in the Indian circumstance, a lot of patients come with preconceived ideas because they're constantly interacting in their communities, you know, about things with others impart. Maybe their friends, maybe their grandmothers, maybe their grandfathers, maybe their uncles, maybe their aunts. And they have all this variety of ideas, and they come with that idea, and they're telling you, and you outrightly cannot contradict them. So you have to participate in patient advocacy to the point how slowly you can change the mindset of that patient, incorporating her beliefs, and by the time the patient leaves the hospital, she has completely changed her opinion and mind, and you made her that fantastic citizen for the rest of the life, you know. She probably will never think back what was not right. So be always a patient advocate. And the valuing the role of intimate care. Now, what does intimate care mean? Again, all that stuff that we discussed until now, you know, essentially intimate care, you know, involves that you're connected with that patient in every aspect of that care. You know everything that is going on. You're constantly kind of bringing back to the patient what is going on. What is the next thing to happen? If you've done a CT scan of the patient or an ultrasound of the patient, you're letting the patient's family know. The results will be let known tomorrow morning. The doctor will come and discuss with you. If you know the results already, you may just communicate, there's nothing serious I was told. Don't take the role of the doctor at that particular moment. You basically say there's nothing serious I was told. So informing the patient at every step of the way also what's going on with his or her care is going to bring in that intimacy and bring in the trust. Not informing, not communicating, just going on the shift times and taking your vital signs and documenting something or entering the computer is not the art of nursing. Absolutely not. Now, you have a double, treble, quadruple role because doctors are getting bad by the day. I'm sure there are not many doctors here except Dr. Praveen here, you know. And doctors are getting bad by the day. I'll tell you why. They don't want to spend enough time with the patients. They have so many things to take care of. They'll come, write their orders, 2 minutes, nurse, please take care of this, please do that, and they walk away. They're not there to listen to the stories of the patients, you know, which they should. They should utilize those few minutes as I spent to engage them with the greatest compassion. They'll reduce your burden. But unfortunately, you're filling for yourself, you're filling for the doctor, you're probably filling in for the administration, and all others in the hospital situation. So you are under tremendous stress, but you can relax with this stress. You have decided, I'm going to fill in for everybody. This patient is mine. I'm going to feel her so comfortable that by the time she walks out, you know, that I made a difference more than anybody else has made in her disease process. If you nurtured that feeling, you'll never make a mistake in your life, or you'll never be unhappy when you're at work. That's all there to it. So it is always, you know, how you relate that's going to make a difference. And that's what intimate care is, and trusting intuition, you know. So essentially, trusting intuition is that, you know, patients are very intuitive. And you need to trust their intuition at the end of the day. And that trusting of the intuition also helps that she can confess to you if something is not going right and tell you. She may tell you about a doctor. Hey, this cardiologist I don't like. You know, then as a nurse, you'll explain to them, he's a very good cardiologist. He's a fantastic interventionalist. Unfortunately, sometimes he's under stress. He could not spend more time with you. And she understands it. Now she would not have, you know, a negative assessment next day when that cardiologist comes. So this is what we call sometimes, you know, trying to unravel the intuitive feeling of the patient and connect with the patient in the whole process, making the journey better. Not talk negative about the doctors. Never, never. Never in a healthcare situation, you should talk negative about your colleagues, other nurses, your supervisors, or other physicians or other healthcare professionals. Never. That one lesson you want to take from this conference is that Be civil at all times. Be civil at all times, and never tell your patients anything about another person. Do not complicate that, which is a very bad behavior. Keep it to yourself, even if your other nurses, you have some animosity with them. Work out that. But you be at your best behavior. So continuation of the therapeutic communication is being mentally, emotionally, and physically prepared, which should be all times, and being punctual and polite. Now you had that bell going, the light flickering, and the patient has done once, twice, thrice, and you're not attended. It could be a very trivial thing. The patient is just calling to please turn the light off. But you're not attended to the patient, she's calling 3 to 4 times. So you're not punctual. You're not attending the needs of the patient. And plus, when you walk in there, you essentially have a grumpy face. You're telling the patient, how many times you have to tell, I heard you. Do you think you're the only patient that I have? I have this other sick patient. You need a bedpan. I'm rushing and getting with a bedpan. No, you cannot yell at the patient, but this happens in real life. So you're being impolite, and above and beyond, you've been non-punctual. So it's a double jeopardy. You hurt the patient already, and then you're yelling at the patient. So please do not do that. Never be grumpy, never be angry. You just apologize. I'm so sorry, I didn't hear the call bell. I'm sorry I was tied up with this patient. I could not do anything better than that. Let me help you, Mrs. Lakshmi. What can I do for you? And she will forget everything. A simple, little, genuine apology that you are really tied up with somebody, and then you're attending to the patient. Now, will that help you? Sometimes patients yell back at you, but you have to still take it with a smile. Then you can take it up to a supervisor and explain to them if somebody is not in the proper form of behavior. But your role in that room, by the bedside, calls for your politeness and your proper attention to the patient, and that is effective communication. So promoting patients' well-being and comfort, and being proficient in nursing skills, and certainly encouraging the patients and praising them, to take better care of themselves. How does this, now especially this particular last thing is extraordinarily important. Now let us take the example of a patient who is diabetic. Now what do diabetes patients, if the patient is insulin dependent, now what do you tell at the time of discharge? You're educating the patient how to store the insulin, how to use the needle, when to use the alcohol pad. Now what do you do after you give the insulin to the patient? But your teaching does not just end there. Now the patient is chronically diabetic. What are the 2 or 3 other conditions you're going to tell the patient? You're going to tell the patient, take care of your skin, take care of your feet. And you also educate them, sometimes your blood sugars can go down. So these are all the other essential parts in the wholesome care of the patient. Now again, it took me 30 seconds to tell the other 3 or 4 things. So you're connecting with the patient, you're encouraging the patient to help them modify a disease pattern and ultimately manage a diabetes effectively, not simply by insulin, but explaining that the complications of low blood sugars that can manifest with sweating, manifest with anxiety, and all those things can happen. Taking care of the skin, because of poor circulation in diabetics can lead to skin problems, skin abrasions, and if it happens, it's a big problem. Taking care of the feet is very important. So these are all the basic things that you have to educate to the patient by effective communication, so that they're encouraged that here is a nurse who cares for me, who is not just giving me the medications and discharge slip and saying we'll see you later, but she's participating and made a difference for my diabetes, and I can trust her better than my husband, my brother, or somebody else there at home, which is not happening in our country. If you want to really bend the curve of the chronic disease outcome, our nurses have to be more communicative, and you have to take that burden. I don't think so our doctors can do it. Okay? Our doctors cannot do it. It is you people who can change this curve for India in terms of their chronic disease pattern. So now, the continuation of the techniques in therapeutic communication, basically listening, actively receiving information, and observing the reactions. Now, you have to be a very keen listener. This is one area where silence is the biggest virtue. Many times we say nurses don't talk, nurses are shy, nurses are timid, they're not expressive. But this one area, when the patient is speaking, you have to be listening till the patient stops the story. Do not interrupt them. Try your best to listen very carefully. Giving that attention to the patient, is extraordinarily important. Now, remaining silent is the greatest virtue. Your periods of non-verbal communication by listening to the patient. Repeating to the patient what is most important. Now, the patient has told, listen, I've been having this chest pain, and I get this, during the middle of the night. I've been taking aspirin, I've been taking nitroglycerin, and I take my glass of water, I take antacids, still my pain comes. So all of these things the patient has said for 1 minute, you have listened. Now restate again back to the patient. It looks like your chest pain is coming very often in spite of taking all the medications. Is that right? And she will say, yes, it's right. Which means to say that you're explaining to the patient you've understood her problem. You're engagingly listening to the patient. And so restating always helps. Reaffirms to the patient that you are a keen listener, which is also a part of effective communication. Now reflecting, asking patient their ideas, their feelings, any other feelings, or any other questions. Always end with that one last question. Is there anything else you would like to tell me? Is there anything else I have forgotten to ask you? Lakshmi garu emana marchipoyana menu adigatraniki. Meer emana cheppedi marchipoyara? Ask that last question to the patient. Now, this is again a lifetime commitment. Make a commitment from Monday morning onwards. You'll end your story with that patient interview by asking that last question. Is there anything else I should know? Or should I ask you any other questions that I have not asked you? That will make you a better person. That already tells for the next 5 days of the patient's stay, you have won the heart of the patient. You have won the heart. You have expressed to herself you care for the patient. Now, planning always involves mutual decision making. It may not be very applicable in a country because of the illiteracy that happens and patients may not be able to understand. But at least for those of them who understand, do not make a unilateral decision. Incorporate the wishes of the patient. Tell the patient, is that okay with you? Tomorrow morning your CAT scan will be at 10 a.m. and will not be giving you breakfast. Is that okay with you? Can we work with that schedule? These are the things. So mutual decision making is always extraordinarily important. If you don't do that, if you're doing it unilaterally, then you lost the trust. And that will also avoid many mistakes. The patient will say, nobody talked to me. Nobody said anything about this. Nobody told me that my surgery is scheduled for tomorrow morning at 9 o'clock. Nobody came into my room, explaining to me my blood tests were abnormal. I need to repeat again another blood test to do. So this is going to be very important where you're incorporating the patient's decision in the process of implementation of your nursing plan and schedule. Now, cross-cultural communications, again, listen with sympathy, explain your perceptions of the problem, and acknowledge their differences and similarities. And certainly, recommend treatment. And if the patient is unwilling, sometimes in the best interest of the patient, try to negotiate an agreement of what is important and what to prioritize so that will help her. If you have 5 tests to do, if the patient is unwilling, rationalize what is the most important and only, then finally negotiate with the patient. Can you please at least do this? This will help the doctor to decide what antibiotic to use. That is the art of negotiation. Now, working in groups, we talked about all morning, I think. I'm sure addressed in all sessions that teamwork is essentially important. So assume responsibility always to share your ideas with other members of the team who participate in the care of the patient. And negotiate to build a consensus. If there's a difference of opinion, always try to negotiate and have a consensus in terms of the planning for the patient. And give and receive feedback, which is very important. And certainly commit to the goals of the patient. Don't contradict to the members of the team. Now, if you have many hospitals now have started this collaborative teams of rounding. In a team, you might have 3, 4, 5 persons. You have a pharmacist, you have a social worker, you have a nurse, you have a doctor, you have a hospital administrator. sometimes all of them might have different ideas in terms of taking care of the patient. Ultimately, each one cannot differ and cannot be upset. You have to come to a consensus. Sometimes you win, sometimes the other person wins. So your attitude should be a team approach is always better, and having a consensus is going to be extraordinarily important. Now, building relationships certainly brings in warmth and asking questions, a genuineness with respect and empathy. And my last few slides, let us understand the impact of laughter. Why are we so serious in India? I'll tell you this story. 30 years, 6 to 7 hours, I used to stand up on my legs, do endoscopies. I would go from room to room to room to room. Out of 6 to 7 hours, I used to make my nurses and the entire team, anesthesiologists, laugh 5 hours. In fact, they used to tell me, Dr. Reddy, you can be a stand-up comedian. Because even at the time of interview in the West, where the doctors and nurses, I used to ask them, do you have sense of humor? I never liked serious people. But you have to be professional. Being comical and being jocular and having a laughing attitude does not mean you can breach your professionalism. I used to tell this always. Be professional, but relax. Have a good joke. Have to tell a story. See what you do. And be constantly talking. I was in the US recently, visiting all these nurses. They're telling what mall they went, Elton John is coming to the Woodlands, $1,000 a ticket they have spent, and all these stories morning till afternoon. Continuously yapping. Obviously, the patient has sedation, he won't hear anything. I hope he's not hearing anything. So the message is that I would like my nurses to really relax, have a smile, not just when somebody is walking, good morning, Sister Josephine, good morning, Dr. Reddy, good afternoon, Dr. Reddy. I don't want a smile for me, but I want to be relaxed even with the patients. A little kind of humor, a little relaxed story, always goes a long way. So the message is that laughter is the most inexpensive and the most effective wonder drug. It is certainly a universal medicine. Now, you know this picture? Patch Adams. How many of you seen this picture? There we go. So that's a hilarious movie. How we used to, essentially in that movie, bring life into the children with leukemias and all sorts of cancers and whatnot. So laugh at yourself. Follow the patient's lead. See what's the reaction, in what mode and moment that patient is. Remark on humorous cards and share some cartoons, share some jokes, and talk gently. When you're trying to tell a joke, don't be too loud. And be creative. Sometimes it may not be a real joke, but you want to humor the patient. Tell a story that enthuses the patient to relax. Maybe something about a husband. Take a cue. The patient is already saying something about a husband, or something about the wife, or whatever, or child. You take a cue from them and build a little story and make her happy. So these are all kind of innovative things in communication, making the patient better. The healing power of laughter, this is the physiology I was talking about. We all know now in science, relaxation, laughter stimulates catecholamines, which is adrenaline, noradrenaline, and will enhance the feelings of well-being. Certainly, it has a tremendous impact on the immune cascade. Even they have said about T-cell phenomena, B-cell phenomena, interleukins. A lot of this science has been so well studied. Essentially, the underlying message is that relaxation, humor, and the persons who are gregarious, they tend to stimulate the immune system for the better of that individual. So you're essentially helping the sickness of the patient to recover much faster. It helps to decrease the anxiety. It certainly, enhances the metabolism of the patient. And as I told you, it increases the T helper cells and also the NK cells, which is the null cells. So it also helps to build confidence and encourages the patient in positive self-talk. My last slide. Caring is certainly the essence of nursing. So in summary, ladies and gentlemen, be concise and clear in your communication. Be affirmative in your approach to the patient. Do not be aggressive. Have some sense of humor. Have a relaxed personality. Involve the family. Involve the patient in a decision-making process. And make it absolutely patient-centric at the end of the day. Thank you all very much.